Okay, I'm going to take you back. I'm going to get your clothes changed. Then you'll meet with Dr. Amron. He's going to mark your body.
Okay.
He's going to take photographs.
Yes.
Going to walk into the operating room. You're awake when you go in, of course.
Yes, of course.
No worries. Your great
yeah.
hand. Dr. Amron does this all the time. He's excellent at what he does. It's like his forte.
I was in Beverly Hills, about to have a plastic surgery operation. For several weeks I'd been meeting the people of Southern California for whom looking their best involves regular trips to the surgeon.
So you generally never want to do the butt itself. I almost never do the butt.
They claim that by changing our outer appearance, we can also change our innermost feelings.
I'm happy. There are not many guys with 50 who look that good.
And now I would be finding out firsthand. The next day, and Laura was about to begin her program of self-transformation. This time, I was hoping to get in on the act and find out if I might be a candidate for something. We were starting with liposuction specialist Dr. David Amron.
Hello, hi Laura.
Hi.
How are you doing?
Good.
How you doing? Hi Eve.
Hi, how are you?
Good to see you again.
Good to
You look
see
nice.
you too. Thank you.
I'm Louis. How do you do?
Hi Louis.
You must be Dr. Amron.
Yes, nice to meet you,
How
Louis.
do you do?
Anyway, how are you?
Good.
Yeah? You
I'm
feel
ready.
good? Ready
Yeah.
to go? Okay, go ahead and just remove the blue gown.
Okay.
And put this
Good.
down.
Ooh, pretty underwear.
Okay, let's just lower this just a hair.
What you're doing now, Dr. Amron, is what exactly?
Well, I'm marking out the areas that I'm doing the liposuction on. Everybody has their own fancy way of going about doing their markings. You know, I mark the area that I'm doing, and I mark the high points and my access points. And that to me is the guide that I use. Go ahead and turn around and face the wall. Okay. Her legs are great. Her inner thighs are great. She's a little full in her upper outer thighs over here, this area called the saddlebag region. This is what's defining her widest point. By just bringing this in a little bit, it's going to give her a better line so she's not so poochy in this area over here. Also, this hip and flank area needs to be brought down. So you generally never want to do the butt itself. I almost never do the butt, but you do around the butt to give a better shape to the butt and make the butt actually look more round by bringing this area down here.
Was that weird for you going through that?
No, not really. I knew he was going to mark me, so I
We
knew
were
I was
just
going to
toys.
get drawn on.
We didn't mean to
I-
objectify you.
No,
You know what I mean?
I like to hear what he's saying. So
Yeah.
I'm excited.
Do you operate on and do liposuction on guys as well?
Yeah, absolutely. I would say that about 25, maybe as much as 30% of people I do are men.
And so you would, in theory, I'm not saying it's appropriate now, but be able to size me up and tell me whether or not I might be an appropriate candidate for a procedure like that.
In about 10 seconds. Yeah, very quickly I can look and tell.
This is no good, apparently. I'm just trying to...
Turn and face the wall. Okay. See, this is very good. This is a very good thing to talk about. You're a pretty good candidate, and I'm going to explain to you why you're a pretty good candidate. You've got some fullness in your stomach and some fullness in your flanks. Okay.
Right.
Now some of this is fat between the skin and muscle, and some of this is just being a little bit. Maybe being a little bit out of shape,
Yeah.
maybe a couple pounds of weight that you can lose by losing some weight. If you lose some weight, it's going to all come down, for sure.
Yes.
But you've got a layer of fat between your skin and muscle. It's about that thick. Also, in your flank areas, you turn around, there is also some fullness here. You've got a great V over here, and you've got this bulging that occurs in the what is this area called? Love handles, as we call it in America. What do you call it in England?
Love handles.
Okay. But what liposuction is going to do, it's going to reduce that layer and make it much thinner.
We are just loving this. We are loving this.
Shoes
Now
on
do
the
you
other foot.
understand how we feel?
Shoes on the other
No, I
foot.
mean,
Have you ever had it done yourself?
I haven't, no. Would I? I would. But I actually am about 8 or 10 pounds overweight and could be in better shape. But when I'm close to my ideal body weight, I'm actually very proportionate. So I just need to lose weight. It's actually a mistake to do it on me. So you brought that one
Dr. Amron began by numbing the incision points through which Laura's fat would be extracted.
So what I'm doing now is I'm putting that tumescent fluid in Laura, and
Then he used tumescent fluid to anesthetize the target areas and dislodge the fat, making it easier to suck out.